Hello and welcome. Today we're diving into a serious and complex condition called urethral necrosis. This condition, involving the death of tissue in the urethra, can have significant consequences for urinary function and overall health. In this video, we'll explore the causes, mechanisms, symptoms, diagnosis, treatment, and potential prevention strategies for urethral necrosis. Let's begin. The causes of urethral necrosis are varied, but they primarily involve factors that compromise the blood supply to the urethra. Prolonged pressure, such as from an indwelling urinary catheter left in place for extended periods without proper care, is a major culprit. Trauma to the pelvic region, either accidental or surgical, can also damage blood vessels supplying the urethra, leading to necrosis. Radiation therapy to the pelvic area, often used in cancer treatment, can also damage the delicate tissues of the urethra and its blood supply over time. Finally, certain infections, particularly those that cause severe inflammation and swelling, can restrict blood flow and contribute to the development of urethral necrosis. In rare cases, vascular diseases affecting small blood vessels can contribute to urethral necrosis. Let's understand how urethral necrosis actually develops. It all starts with a lack of oxygen, also known as ischemia. When the blood supply to the urethral tissue is compromised, cells are deprived of the oxygen and nutrients they need to survive. This initiates a cascade of cellular damage. Initially, the cells suffer reversible injury. However, if the ischemia persists, the damage becomes irreversible, leading to cell death or necrosis. As the tissue dies, it weakens the urethral wall, potentially leading to strictures, fistulas, or even complete urethral disruption. The body's inflammatory response to the necrotic tissue can further exacerbate the damage and contribute to scarring. In summary, it's a progressive cycle that begins with ischemia and culminates in tissue death and potential structural complications. Unfortunately, precise epidemiological data on urethral necrosis is limited, as it is relatively uncommon and often arises as a complication of other medical conditions or procedures. However, we know certain groups are at higher risk. Individuals requiring long-term catheterization, particularly those in nursing homes or with chronic medical conditions, are more susceptible. Men are also affected by urethral necrosis due to anatomical factors, as the male urethra is longer and more complex than the female urethra, making it more vulnerable to injury. People undergoing pelvic radiation therapy for prostate, bladder, or rectal cancer are also at elevated risk. Finally, patients with underlying vascular diseases, such as diabetes or peripheral artery disease, are more prone to developing urethral necrosis due to compromised blood flow. The signs and symptoms of urethral necrosis can vary depending on the severity and location of the affected tissue. Common symptoms include difficulty urinating, weak urine stream, and increased urinary frequency or urgency. Blood in the urine, known as hematuria, is another alarming sign. Patients may also experience pain or discomfort in the pelvic region or during urination. In severe cases, a urethral fistula, an abnormal connection between the urethra and another organ or the skin, may develop, leading to urine leakage. If an infection develops in the necrotic tissue, symptoms like fever, chills, and increased pain are to be anticipated. It's important to note that these symptoms can also be present in other conditions, so it's essential to seek medical attention for proper diagnosis. Diagnosing urethral necrosis involves a combination of clinical evaluation and diagnostic testing. The doctor will start by taking a detailed medical history and performing a physical examination. A urine analysis can help identify infection or blood in the urine. Urethroscopy, a procedure in which a thin, flexible tube with a camera is inserted into the urethra, allows direct visualization of the urethral lining in any areas of necrosis. Imaging studies, such as a retrograde urethrogram, where dye is injected into the urethra and X-rays are taken, can help delineate the extent and location of the damage. In some cases, a biopsy of the affected tissue may be necessary to confirm the diagnosis and rule out other conditions. While urethral necrosis isn't formally classified into distinct types, the severity and extent of the tissue damage can vary. Some cases may involve only superficial necrosis, affecting the inner lining of the urethra, while others can involve full-thickness necrosis, extending through all layers of the urethral wall. The location of the necrosis can also vary, affecting different segments of the urethra. The presence of complications, such as strictures or fistulas, also contributes to the complexity of the condition. Treatment and management of urethral necrosis aim to address the underlying cause, remove necrotic tissue, and repair the urethra. Initial management often involves addressing any infection with antibiotics. Surgical debridement, the removal of dead tissue, is often necessary to promote healing. Depending on the extent of the damage, reconstructive surgery may be required to repair the urethra. This can involve techniques such as tissue grafts or flaps to restore urethral integrity. In some cases, a temporary urinary diversion, such as a suprapubic catheter, may be necessary to allow the urethra to heal. Ongoing monitoring is crucial to detect and manage any complications. Preventing urethral necrosis primarily involves minimizing the risk factors. For patients requiring indwelling urinary catheters, proper catheter care and timely removal are essential. Avoiding prolonged pressure on the urethra is critical. Careful surgical technique during pelvic procedures can minimize the risk of trauma. Patients undergoing pelvic radiation therapy should be closely monitored for any signs of urethral damage. In some cases, medications or other interventions may be used to protect the urethra during radiation therapy. People with vascular diseases should manage their underlying conditions to improve blood flow to the urethra. Regular checkups with a healthcare provider can help identify and address any potential risk factors early on. The prognosis for urethral necrosis varies depending on the severity of the condition, the extent of the damage, and the presence of complications. With prompt diagnosis and appropriate treatment, many patients can achieve good outcomes. However, some patients may experience long-term complications, such as urethral strictures or fistulas, requiring ongoing management. Recent research focuses on developing new techniques for urethral reconstruction and exploring the potential of regenerative medicine to promote tissue healing. Further research is needed to better understand the underlying mechanisms of urethral necrosis and develop more effective prevention and treatment strategies. Thank you for joining us as we explored urethral necrosis. Remember to consult with a healthcare professional for any health concerns.